Hello everybody. So you are watching Urogynecology for Beginners and we have got this for you today. This is a pessary and I have with me today two very cute postgraduates to discuss this topic of pessary. On my right is Dr. Ananya and left is Priya Patil. Both are third year postgraduates and it is just a casual discussion which we are going to do about pessary. And why did we think to discuss this topic? Because one of the videos which was shot a few months ago in our channel by Dr. Ritvika went really viral. Okay, Priya, how many views were there?
It has crossed 42K.
42K views in a few months, which is like something very big. So which prompted us, maybe this is something which everybody is wanting to know about pessary. And I personally feel that as during this COVID, actually I realized that how much was the worth of this pessary, because we were not doing any elective surgeries, and many women who were coming and who were actually posted on certain dates and the things got suddenly shut and we had to give them this pessary, and they are so happy now they don't want surgery. They are very happy with the pessary, and 3 months 6 monthly checkup and removal and change they come, and they say that they are very happy and satisfied. So we realized the worth of this pessary when the pandemic came. And you never know how many pandemics are awaiting yet to come. And so I think it is very important that all of us should understand the worth of this single ring, which is a pessary, for our urogynecology patient. So with this idea in mind, we'll do the discussion. So this is a pessary. So Ananya, can you tell me this ring pessary? Let me tell you one thing, that in Indian market, only this ring pessary is available. So what are the patients, in which patient you would like to use this pessary? Like, what are the indications in urogynecology? This is for urogynecology patients only. What are the indications to use a pessary?
So, ma'am, pessaries can be used in pelvic organ prolapse patients with SUI. Usually, there's a misconception that pessary is advised only for elderly population who's not fit for surgery or who's not willing for surgery. But actually, young patients with a strong pelvic floor can also be advised.
That is a very good, because they can retain the pessary better. A smaller pessary can be retained better. Actually, when I had gone to Germany for my training, there are more young women were being prescribed pessary, especially for SUI. But let me make it one thing very clear, that in India we do not get pessary for SUI. Pessary for SUI will have a knob which will press against the bladder neck. We don't get it there, so we will not be doing much discussion about SUI. But as Ananya said, it is very important, and it was the trend there. Younger women were using more of pessary and elderly were undergoing surgeries. One more problem: if you operate a young woman at 30 years, 40 years for prolapse, there is chance that it will recur. Okay, so once pessary fails, at least you can use, you can do surgery. But if surgery fails, then you cannot, for wall prolapse, you cannot put pessary. It will not work. So that was one idea. So how do you examine, Priya? These are the indications. Or let's talk about some contraindication. She said that pelvic organ prolapse, mostly young women we are talking. And can we use it in like procedentia or big prolapse or big introitus?
Our pessaries are not as big to support uterus which has completely prolapsed, including the fundus. And it's not going to help. We have to realize that she has crossed the stage where, conservative management can be done.
So early stages, pessary is a better choice as compared to those with later stage. And wall prolapse, with it doesn't work.
No support.
So it's very important. What you said, Ananya, actually makes a lot of sense, that when pelvic floor is good, strong, then only the pessary will be held properly. Otherwise, patient coughs once, it will come out. She strains to pass urine or motion, it will come out. It will not be held. So it is more useful in young women with good pelvic organ support, pelvic muscle support, and also in early stages of prolapse. Okay. Any other contraindication, Priya, you can think of if you are examining a patient? For this particular patient, you should not put pessary. What are those patients?
Infection.
Yes. active infection, you should not put a foreign body inside. So it is a relative contraindication. You can always treat that
First,
first
infection.
an infection and then call the
Or
patient
any
for
ulcer if we find.
any ulcer.
On the vaginal
Because of
wall
that.
especially,
Yes.
not the decubitus ulcer. Decubitus ulcer, pessary
Is
is the
the
treatment
treatment.
of choice.
Correct.
Whereas the vaginal wall ulcers, or in patients which we have already put pessary and then she has come for change of pessary after 3 months, then ideal examination is important. We
Yes.
can't put another pessary and cause that ulcer to deepen.
Yes. Okay. So, what are these types of pessary? If we talk about the types, this pessary which I am holding is very soft and nice. Which pessary is
Ring
this?
pessary,
Silicone.
Silicon
Yes.
pessary. Okay, so for many, this also has a very interesting story. I have already
Yes.
told you, you know that initially when we were using pessary in our hospital, the supply which we were getting
Plastic.
was plastic, which is very hard.
Hard.
And causes a lot of ulceration
Yeah.
in patients. I spoke to many of the distributors and many companies, but nobody was ready to manufacture silicon pessaries, which were in my contact. And last time, I think in one of the case discussions,
We got it
we
from
asked
somewhere.
also, but nobody responded to it. So what happened? We had in the month of April, March 2022, and there I was just discussing with Dr. Jennifer King, who had come from Australia as our special guest, and she gave me an idea. She said that she will talk there also if they can send it. But suddenly one day she messaged me and she said, "Why don't you try in eBay?" I was surprised because that I thought eBay will not sell pessary. And as you know that in India we use more of Amazon. As compared to eBay. So just as a curiosity, I was very sure that I'll not get, but I typed pessary for prolapse, vaginal pessary for prolapse, and I got so many options there. Then I restricted the thing filter for silicon pessaries, and again I got a very cheap rate. So I got a set of. Can you show Priya these pessaries? One, two,
Multiple,
no, these are different. These two are different, but these came in one set. I think this set costed me some 800 rupees. So how many? 3 pessaries here and 2 pessaries.
3 there.
3 there. 6 pessaries and some 850 rupees, which is a good deal. 150 rupees was approximately the cost of one pessary. So in different sizes, we got the pessary. And one of you, whosoever wants to tell me how to choose a size. Before that, I want to tell you one thing. The small pessary, which one, Priya, you were showing? This girl was asking me in the beginning, "Ma'am, this is such a small pessary. Is it for babies?" No, it is not for babies. Some women, actually, I'm using this pessary in one of my patients, this size pessary. If the introitus is very small, then also patient can have cystocele. This patient has a cystocele grade 3, but the pelvis is very small. She's a small built patient, and her introitus and vagina is very narrow. So one patient comes, and every 6 months we are changing same size of pessary for her, and sometimes it's difficult to get the size. So the pessaries here, they have given us 6 sizes of pessary.
6 sizes.
Starting from this is the smallest size and this is the largest size. You can open and show all. One of you can hold. So see,
Usually
if you do like this, you can.
These are the medium sizes.
Medium size pessary. So now when you have so much of choice,
Yes.
who will tell me how do you measure the size, which size for which patient? Do you have a technique to find out that?
Yeah, sure. And ma'am, I'll demonstrate using this
Okay, sure.
model. So once you expose the perineum of the patient with your index finger and middle finger with gloves on, you measure the size of the pessary. You insert both the fingers and in such a way that your middle finger hits the posterior fornix, and you measure it until the edge where the symphysis pubis is hitting your finger. So say for example in this model the size is coming up to here. So then
you can mark it with the pen if you forget. And then you can mark.
So you insert.
You want me to mark? Okay.
And you check. No.
Huh.
So you have to see where it is reaching the symphysis pubis and mark it. So this happens to be the diameter of the pessary.
So according to this, you have to select a pessary that fits that diameter.
Will it fit, or you want a larger pessary?
I think this.
That will fit. This
That
is,
will fit.
as we see that this will be too big.
Huh. And if suppose you are confused, like I was in this case, that there is a bigger pessary and a smaller pessary, which one do you choose?
We
Always
actually
choose the
choose the
smaller
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 one.
pessary, always.
So, because if you use the larger, you can always have this trial and error options when there's so
Yes.
many pessaries available. You can always see, because pessaries, each perineum is different. So the pessaries come in fixed sizes. So you can always insert and check. There's also a method where you have to, after insertion, you're supposed to sweep your fingers around the pessary to see that it is not too tight. Too tight will cause abrasions and ulcerations. So, and also will make the patient extremely uncomfortable. And what is most dreaded is she won't be able to pass urine after insertion if the pessary is too large for her.
So we'll discuss it, how to check after putting the
Yeah.
pessary. First, one of you has to show me. You have measured the size. I
Yes,
hope
ma'am.
all of you have understood how.
Yes.
And then you tell me one thing. Suppose you
Yes.
don't know. Priya said that posterior fornix will hit.
Yes.
It is exactly like, I feel it is exactly the way we are taught to do obstetric conjugate,
Yes,
yeah.
in pelvic. So,
Yes.
what is
So-
the other landmark we can use?
So you can use the sacral promontory as your landmark in the
Landmark,
posterior
okay.
fornix.
So
and
if you are confused where to keep your finger in posterior fornix, you can even go
Sacral
do it
promontory.
exactly the same way how you do it for a laboring patient, and obstetric conjugate, how you measure it, is exactly the same thing, and that is the diameter. She has beautifully shown how to measure it. Now who will show me how to insert it? You have measured, you have selected which size of pessary? This
the
size of
medium size
pessary,
we selected.
medium size. So how do you use it?
So for using, you have to fold the pessary and it should become like this. Usually, the concave side, this is the pessary when you folded it, the concave side should come up. And now you should go near the patient. Once you try to reach the posterior fornix, you have to release the pessary. And then anteriorly, you have to hinge it just behind the pubic symphysis and then leave it. After this, you should ask the patient to get up.
First you sweep. Priya just told to
Yes.
sweep the finger around.
After placing it and hinging it behind the pubic symphysis, you should gently sweep your index finger all around the vagina to see no mucosa should be caught inside the pessary, and it should be the appropriate size for that patient.
Sit. Then how do you tell? Now you have inserted the pessary. Patient is still lying on the couch.
Now we will ask the patient to do a Valsalva maneuver, ask her to cough to see if pessary evidently comes out. Otherwise, if it seems the right fit, you can ask the patient to get up. She should be encouraged to walk around, sit, pass urine, and then she should come back later for a review checkup of the appropriate size one.
So what all can happen when she is walking and she goes to pass urine? What all are the possibilities?
The most evident one is the pessary comes out on its own.
Pessary falls.
It falls. It's expelled. And second is she's not able to pass urine.
Yes.
Never send a patient back home without her passing urine after pessary insertion. Because urinary retention may propose as a bigger problem than her prolapse of the uterus itself.
Yes.
And she would come back running to you saying, doctor did something and there's a lot of pain.
Yes. And if she goes to some other clinic, people might catheterize and do things. That patient is having urinary retention. The simple treatment will be
Just remove
the pessary.
Pessary.
Okay, remove the pessary and she'll be able to pass. So if suppose this patient, this lady is there and she's walking around and goes to pass urine and the pessary comes out, what is the interpretation?
That means that size is smaller for her. You can try the next size for her.
Size. Okay, correct. If suppose this same patient, the pessary is not falling down, but patient is also comfortable, but when she goes to pass urine, she says that she's feeling the urge to pass urine. That is one of the possibilities. So you have to listen very carefully. Maybe patient's bladder is not full and you are telling you pass urine, patient goes back and says that I am not able. So you say that, are you having the urge to pass urine? Patient says that she is having the urge to pass urine and still she is not able to pass urine. That means the size
pessary is big.
And then you have to come down a size.
So try that pessary.
So trial and error.
Trial and error
is
method.
the way.
And there is nothing to feel bad about it. Everywhere it is, everybody knows that we do not have a specific size. We have to do a trial and error method to give patient the best result. Neither you should feel bad about it, not the patient should feel agitated or irritated. You have to counsel her in some way that I want to give you the best size. When you go to choose clothes, dresses for yourself, you do the same thing.
Yeah.
No, we see this size is not fitting.
Yes.
Someone.
So it is the same way. So sometimes I have seen that doctors feel very bad that they could not tell the correct size, and patients felt very irritated that every time, what is this, that they are coming, and it is just like choosing your right fit,
Yes, ma'am.
isn't it? Then what else you want to discuss?
So after you send the patient home, you need to call her 3 monthly initially for follow-up to see if it's the proper size. It
So
should not
every
cause any
3 months, do
abrasion.
you suggest, Ananya, that they should change the pessary?
For the first 2-3 months, she should come to us so that we
Come
can
to
check.
us. You are checking.
Yes.
Everything
Not
is perfect.
required.
Yes.
Do you change the pessary?
No.
Not required.
Then she can.
Not
Yes.
required.
Okay. So first 3 months when you call her, you just come to see that ulcers have not developed, ask her history, see whether it is not too tight. Sometimes that time your judgment might be wrong, and later you feel no, it is very
Tight.
These are the circumstances when you should change the pessary. But every time when she comes for 3 months visit, you need not change her pessary. Then when should you cut? Now suppose this ring was perfectly fitting, there was no discharge, minimal discharge after putting the pessary is normal. You
Yes,
should ignore it. Okay, that is the reaction of vaginal mucosa to a foreign body. But if it is too much, foul smelling, causing other problems, ulceration, you saw some bleeding there, then definitely you must remove
it.
And if you remove, suppose there is an ulceration and lot of foul smelling vaginal discharge, should you immediately put a pessary?
No, you should always treat the infection first and then call her back. Just
So I
assess
said
it.
there is infection and maybe some ulceration also. So if there is an ulceration, what is the treatment?
You remove that and not
Remove
put it
that.
again.
Do you want
Some
to give
local
some cream?
Evelon cream
Local.
we can give her.
Evelon,
Local
some
cream.
estrogen cream for
For
local
healing better, because most of these women are postmenopausal and there's less blood supply to the
Yes.
vaginal mucosa, so the creams might help better healing.
So that is also something not to be embarrassed and feel bad about it. This is a known complication, and the vaginal mucosa heals very fast. Okay, you can call her actually after 2 to 3 weeks, though it would have healed in 5 days or so, 5 to 7 days. But at least give her some time to get out of that infection and inflammation. And after 2 to 3 weeks, you can reinsert the pessary. Okay. So, what are the worst cases of pessary complication have you seen?
I have seen actually a lot of ulcerations where the patient feels like we have done something wrong with her. So I feel educating the patient and explaining the complication, that these are very common complications, is extremely important. Otherwise they feel like, oh, I started bleeding after pessary. I started having this problem and pain after pessary, and they will refuse. They'll straight away refuse that I don't want this reinsertion. Although sometimes I've seen that first time when the patient comes, it's 3rd-degree prolapse, and after you remove the pessary to put another pessary, it will be 2nd-degree. So it has gone back.
So why it goes
Fibrosis.
back? Fibrosis.
Yeah.
And this point, actually what Priya told is a very important point, and we have to keep in mind, because sometimes just to delay the time, like in COVID times we are doing, we put pessary and it causes fibrosis. So what happened with me, real life incidents, that this patient was on pessary and the prolapse has almost gone. But patient was some nurse's mother. So she wanted to get operated. We told her also sometimes. But then after that patient was lost to follow-up. Suddenly one day patient presented, and I don't know, senior people did not see her. And by some PG, she came on non-OPD day. She was posted for surgery. It was our mistake only.
I think
that
I
we
was
did
there.
not. And though it was before that, sometimes Pradeep was there that time. Okay. So I was doing vaginal hysterectomy, and the prolapse is totally gone. She has fibrosis. And somehow I had forgotten when patient, means it's my mistake also, we should go through properly. I remember that patient, but every patient you cannot remember exactly what events have happened. So anyway, the plan was, with difficulty that prolapse came up to introitus. We had written everywhere 3rd-degree uterine, 3rd-degree. And I totally forgot how many pessaries she has taken, and I could not recollect actually. Anyway, prolapse was there. We thought that we have to do surgery, and I started doing surgery, and that is one day when I injured the bladder. Okay, because there were so many adhesions there. There was no plane to go. I think there were ulcers. Patient was on 3-4 years follow up. Sometimes she used pessary, sometimes She did not.
On
It is
and
not
off.
her. On and off she used. And then when I went back, I saw we had only written that she has developed 2 to 3 times ulcerations in vagina. And while I was opening the interval, that is one time I remember I had opened the bladder. If you open the bladder, what is the management?
Not to panic.
Not to panic.
Repair
yes.
it.
Repair
Either
it.
you can repair
And
it
put
before your
Foley's.
surgery, or you can finish your surgery if you're confident enough. You can finish your surgery and then come back to
Then
bladder
come back.
repairing.
What will you do?
We'll
Acha, first,
close
tell me one thing. You are in urogynecology. Do you call a urologist to close the bladder?
No, ma'am.
No, not
We-
required actually. What they like, I have seen, like, I mean, medical legally it is a different issue, but whenever we call the urologist, they close it as 2-layer continuous closure. It is actually, we can also close it.
No,
but
yes.
identification of the anatomy is
It's important, that
important, yeah.
if you are doing vaginal hysterectomy, I think you must know,
yeah.
because it is a known complication.
Yeah.
You must know how to deal with it, okay? Because first thing, if you call urologist, you have not told them before, they take time. By the time edema and all sets up, okay? And you are unnecessarily getting panicky that time. And the second thing, what I have noticed, that urologists don't know, excuse me if any urologist is watching that is my, they say that even if we are doing vaginal hysterectomy, they will tell that they want to open from above, because they are not well versed with the vaginal route of repair.
Okay.
They don't know how.
Yes.
They, I don't know. Many
maybe
of the
they don't do it
urologists,
very
they don't do it
often, so they're not
don't do it.
expert.
And it can be done. Vaginal repair is very simple. Usually, when we open, it is supratrigonal part
Okay,
during
ma'am.
vaginal hysterectomy. And nicely 2-layer closure. That's not a big deal. At the end, always check
Methylene
the integrity.
blue.
Put methylene blue and see that you have done a watertight closure.
Okay.
That is more than keep
And
the
keep
catheter
Foley's for 14
Very
days,
good.
and it will heal.
It will
Bladder
heal.
mucosa is also
Bladder mucosa
good
is a very
regenerating.
forgiving
Yeah.
organ that will
Do we
heal.
put interrupted or continuous surgery?
So anything is okay, interrupted as well as use a thin, because the mucosa is very thin. Use 2-0 or 3-0
Yeah,
Vicryl
3-0 Vicryl is
very
what they
good.
use. Yeah.
If you don't have, you can even 2-0 is also okay. So you take the mucosa first, then you do the serosa. You keep the catheter, it will heal. Okay. And usually, whenever we are doing surgeries, we are not going into trigonal or infratrigonal area. We are usually opening the dome of the bladder, which is easy to suture also. Now, this question also I want to take up, though it is not related to pessary. By chance, she said that you can, if you are doing surgery, hopefully never you will open the bladder, but if by chance it happens, you gave me 2 options. You would like to finish the surgery and do the bladder repair, or repair the bladder first and
come to
so 2
surgery.
options. Which one do you want to do, Ananya?
So I would, if I'm confident and the bladder injury I can see and manage for the time being, I would like to finish my surgery and
Finish
then
your surgery?
Yes.
But I want to give this, first you repair it.
Okay.
That thing will, otherwise the entire time you are doing your surgery, there's, oh my God, I have
Or
injured
maybe
bladder,
when
I have
you
injured bladder.
Open it maybe wrong plane also if you're
Wrong
entering.
plane also, how you can enter. And the other important thing, see, bladder is never empty. Ureter are producing. It will
It'll
keep
keep
on
dripping,
flowing. And more, it is very important that that thought goes, you know that, okay, you did one complication, you managed it. Nicely now you. I have done sometimes that once in rectal injury, I did this thing, same thing, that I finished my surgery first. Actually, I realized that while finishing the surgery fast, that stress was there and maybe the tear became little bigger. While pulling, pushing. So once you close it, you know what you have done, then you go ahead and do. But both things are okay. But if I have to teach somebody, I'll tell them that don't panic. First, whatever complication you have done, see it, because that time the tissues are not edematous, not bleeding much. You finish that, you will be happy that you have done one complication, but you have managed it successfully. Then you can finish your surgery. So
We learn.
this is we learn from our mistakes. Doing mistakes is not bad. Repeating them again and again is not advisable, but is not good. But everybody makes mistake. Everybody, the person who goes to OT, who is managing patient, will have complication. Only people who do not have complication are
Those who don't operate surgery. There's a saying, no, if an obstetrician hasn't opened the bladder, they haven't operated
enough.
enough.
Okay. So then coming back to pessary today. So what we were discussing in pessary?
We finished the complications. We finished how to check post pessary insertion and the follow up.
I think we should talk about how we can educate the masses
Yeah.
on pessary hygiene, ma'am. How they can check for
pessary
pessary
hygiene, and maybe this awareness that we have a non-surgical option also available.
Yes.
Okay, so can you show other pessaries which we have collected? I think this one manufacturer gave that this blue pessary and this white
Both, yeah.
pessary. Both are
These-
silicon pessary,
yeah.
but I think the pessaries which we got from Amazon are the best
better.
pessaries.
These are so
These
much
are
better than the
soft.
plastic ones.
These don't.
Plastic.
I have used
seem
this.
less-
This doesn't bend very easily.
Yes.
These silicon ones seem less traumatic also
Less
than
traumatic
the
also.
plastic ones that we use.
Definitely.
So patients can check in Amazon, maybe they can get their pessary and we can sterilize them here and then we can put it. You can also tell, it's not that, many times I got this from West Bengal and also from UP. Some of my friends said that the pessaries are not available. With Amazon, finding it on Amazon was like finding a
Boon.
something,
Amazon
a treasure.
is a boon.
Yeah.
So anybody from anywhere can order pessary, and we do not have sterilization very strict for it, which I know already has a lot of microflora. So you have to dip it in 10 minutes in Savlon solution, then wash it nicely with normal saline. It is good to insert, to be inserted in the vagina.
Out of context nowadays, even those vaginal dilators are available on Amazon.
Yes,
it's-
vaginal dilators, I knew that it is
Available. So that those are like self-use kits. They're available. You can give the patient and ask them to. They're more comfortable also because they can do it at home.
So it's really Amazon. It's not a Amazon promotional video. But it came as a surprise, and I really want to thank Dr. Jennifer King who gave the idea. Because so many years I was thinking, and we never had this luxury to have. Now we are putting these kind of pessaries for many patients. Actually, I tell them, I take a picture and show them. I said, order from this side and come next time. And patient education, as Ananya was saying, it really helps, because many patients don't come to hospital thinking that we'll operate. As soon as they land up in the hospital, we'll tell that this uterus has to be removed and you require surgery. They must understand there is a non-surgical option also, and very good option which works nicely, and that is
Pessary.
So I think it was anything
even
else?
to tell them that we need to reinforce this to patient, that pessary insertion, even though it seems like a foreign body inside, it will not hamper their bowel, bladder, or even sexual function coming to young patients. Like they have this in their mind that with a foreign body, with a ring inside.
And actually, when I was telling you, when I was in my training in Germany, there were many young patients were using pessary for prolapse as well as for SUI. And these pessaries are so good that you can even remove, if you are educated properly, you can remove and reinsert it themselves also. So in the night time, they were removing the pessary. Morning when they were going to work, like you change your dress, they were putting the pessary inside.
I think with invention of all the tampons and the menstrual cup, I think people also will be more accepting of something inside, like a pessary also. They would.
And contraceptive rings. Okay.
No
So
rings
young women,
and everything.
young women should be more accepting this pessary thing, and we should promote. If we don't give the option, see the way this menstrual cups are so much promoted.
In government, I actually had gone to a camp where the government teacher was. I asked her how many pads do you change per day. She said I use menstrual cups, and I was actually taken back. And then she was telling that government is promoting menstrual cups.
And they are giving free menstrual
Free
cups.
menstrual cups. So she said, if I don't use it, how do I teach the adolescent girls to use? So it was. Now I think we have to use another terminology, like how many cloths or pads, like how many times do you empty and how much ml.
Correct.
So in India, the thing is to reach the masses, we need to educate them. So many people with UV prolapse will be benefited with pessary if this information reaches them and they know there is an alternative to surgery and it's quite effective.
And those who are listening to this and thinking that, if some patient or some ladies listening to this and thinking that, oh my God, you are the only person, it's not. If you see the population above 40 years, every third to fourth lady will be having some kind of prolapse with some kind of disturbance and symptoms. So you are not alone. Many people want this, and this is a very acceptable treatment. The only problem is the Indian market has not understood the use of this pessary, and we are slowly working towards it.
Yeah.
Someday, and I have so many ideas. I want to improve this pessary actually.
Yes.
That I will not tell you. But that is in my next list of innovation, that we have to do so many changes that it becomes more useful and more beneficial for the patient. And I think that was a good discussion,
Yes,
and
ma'am.
we can stop with
Yes.
this happy note.
Yes.
Okay. Thank you so much.
Thank you.